Good afternoon and welcome to our Global Health Undergraduate Commencement. For those of you who haven't met me, I'm Chris Byer. I'm the director of the program, and this is my first year directing this wonderful Global Health Institute, so this is my first commencement, and it's wonderful to be here with all of you. I know many of the families here have traveled great distances to be here today, and and many, of course, who couldn't be here in person are joining us online. But to all of you, let me offer my congratulations on your students' accomplishment and my sincere thanks for entrusting these wonderful young minds to us for the last 4 years. They're a remarkable group, and we're proud as a community to get together to honor them today. We're honoring 34 graduates who have completed majors in global health. 5 of these students have earned graduate honors with distinction. So that is really quite, And that, of course, requires additional research and scholarly work that's reviewed by our faculty. Thanks. All of these students have successfully navigated a path at Duke that can be quite complicated. At this university, global health is a co-major. You can't just major in global health. So that has meant that these graduates have managed their global health major requirements while also completing a second major. You're awesome to do that. That is not easy. This reflects the belief that global health is inherently interdisciplinary, and solving the complex health problems that we all face, that our world faces, really requires people with multiple areas of expertise. So each and every one of you has that. These global health graduates have combined global health with a wide array of fields, including biology, psychology, biomedical engineering, history, romance studies, and dance. I don't know how the dance and global health thing works, but it's amazing. And that, of course, that variety makes for a very vibrant exchange of skills, but it also makes for some complicated logistics. And this weekend, for many of our graduates and families, in fact, several people can't be here because their other major is having this commencement at the same time. So we salute them and their families as well. But just to say thank you all for making the time to honor these students and the extraordinary work they've done in global health. And I might just take a moment to ask all of you to take a moment and thank your families and the people who've supported you here, your loved ones. Yeah. We all all want to thank all the families and the loved ones who stood by our graduates on every step of this journey. You prepared these students to be strong in the face of challenge. And of course, these classes graduating this year at Duke actually spent much of their time here during the COVID-19 emergency. So those are unprecedented challenges that all these people have risen to. And you were there to help them really reach this milestone with encouragement and support. It really means a great deal. I know we also want, of course, to thank our faculty and staff, many of whom are here today. Our faculty are dedicated to our students' growth and development. They do a remarkable job, and they have really relished the opportunity to work with all of you these past years. I want to especially recognize the extraordinary effort of our education team, who is here, led by Mary Story, and our Director of Education Programs, Associate Director at the Institute, and also Dennis Clements, who's our Director of Undergraduate Studies, and plays such an important role in the education. And the members of the education team, Laura Bay, Lisa McKean, Emily Kerr, Alexis Kucinich, Shania Parker, and Megan Haas, who do many things every day in support of our students and our program, and would literally not be here today without their incredible efforts. Let's thank the education. But most of all, of course, we're here to salute this extraordinary group of graduates. This is a cohort that chose to study global health in the middle of a global health crisis. You're going to be able to tell that story to your grandchildren, I assure you. And most of you had really not finished your first year on campus when COVID really changed everything. It's extraordinary today at this commencement. Some of you will know, if you've seen in the news, that today officially the United States COVID emergency has been lifted. So you made it. You made it all the way through. Yeah. I'm sure these past 4 years were not what you all expected from your career at Duke, but you have really risen to every one of these challenges that the pandemic put in your path, and you've done it with resilience. And we continue to be amazed and inspired by your ability to adapt to these changing circumstances. And those qualities are going to serve you well when you get out into the world. It is a very changeable place. This is maybe a once-in-a-century pandemic, but unfortunately, all these once-in-a-century things are coming a lot more frequently, as we all know. And of course, you didn't do this alone. You had the support of your mentors and professors, your families and friends, and countless others who've helped you along the way. You did the readings, you wrote the papers, you got yourself up for those early morning lectures, but today is really a day to feel gratitude for those who made your journey a little easier. Many people contributed to your success, just as you've contributed to the successes of each other. This will be true for the big moments that come in your lives, and hopefully it's one of the most important things you've learned here. The late Paul Farmer, who was a global health visionary and a Duke alum, started his global health work as an undergrad at this university, said, with rare exceptions, all the most important achievements in your life will be done in partnership. As you leave today and go on to the next great adventures of your lives, I encourage you to think about those words and really embrace them, and to bring this collaborative spirit to whatever path you follow. Each of you is capable of greatness, but you don't need to do that on your own. And if you stay in global health, you can't. It's a collaborative field. I think hopefully you've learned that it's really important to ask for help when you need it and to offer help when you have it to give. Invite the perspectives of others around you, especially those who don't have power or privilege. And we hope that we've given you some of the knowledge and skills that will help you along that journey. But it's the openness, the integrity, the compassion that you've demonstrated in these past few years that will carry you the furthest. If you continue to center those values in your work, we have no doubt that you will accomplish much in helping to build a healthier, more equitable, and more just world. So on behalf of the DGHI faculty and staff, our global partners, and your families and friends, I want to congratulate you all on your graduation and just say, we really can't wait to see what you do next. Congratulations. In a moment, we're going to hear from our selected speakers. But before I introduce them, just a few housekeeping details. We do have an audience watching online, so please do silence your phones and pagers, devices. We're also going to have the students go up this middle aisle, so we'd ask you to just keep that clear as they're walking across the stage. And then please join us in the atrium for reception after the ceremony. It's a wonderful time to spend some time with the faculty and with the new friends that your graduates have made. So I'm now going to introduce our two speakers, one faculty and one student. And this is really a lovely thing that these are the people that the graduates nominated to speak on their behalf. So one faculty member that they've nominated, Professor Eve Puffer, who just was named to a new chair position 2 days ago in psychology. So we're delighted about that. Congratulations, Eve. And then she will be followed by our student speaker, Haley Cianfolo. So Eve, the floor is yours.
Thank you so much. Good afternoon to all the families, friends, faculty, staff, and graduates. Thank you so much for nominating me to speak with you today. I am truly honored to be just part of your celebration of all that you've accomplished while you study global health here at Duke. I'm trained as a child psychologist, so I often start our research team meetings with a feelings check-in. And with the feelings check-in, we all just share one word about how we're feeling on that day. But my guess is if I asked for one word from all of you, we would hear a wide variety of emotions. Hopefully happiness, joy, and pride of all that you've accomplished, but probably a little bit of worry and fear as you figure out your next steps. Some of you may know exactly what you're doing next and feel confident about where that path will lead. But if you don't, if you're feeling at least a little uncertainty about what your future holds, I want to suggest to you today that an unpredictable and winding path is okay, and maybe even better than a straight one. As a mental health researcher, I think a lot about how people make choices. And as a faculty member, I miss working with therapy clients. But I still get to talk to incredible humans all the time about their choices and how they make them. Just not in therapy, but in office hours and all the lunches that we've had together. Office hours conversations often go something like this. I thought I wanted to pursue this path, but then I took this class that I just loved and this other thing. So maybe now I should do that. I just don't know how to decide. I just want to make sure that I know what I really want to do before I make a decision. And often to your disappointment, I do very little to help students decide for sure what they really want to do. I do much more of normalizing uncertainty, and I try to make it feel a little bit less scary to be unsure. Needing to be absolutely sure usually leads to feeling stuck with a lot of imperfect choices, stuck with a lot of uncertain feelings, and stuck with the fear of unpredictable endings of what might happen if you make the wrong choice. Needing to be sure often paralyzes us. So today, maybe you can humor me with one last office hour or one 8-minute version of an office hour, so that we can reflect a little bit on how not being sure might be a gift. As I sat down to write this speech and reflected on how we make big choices, I started thinking about the stories of my students over the past 11 years. Students who sat in these exact same seats, who left this room not at all sure that their next steps would be the right steps. And who, since graduation, have taken such unpredictable and exciting twists and turns on their paths so far. So I sent an email to 18 of my former students with the subject line, urgent need for inspiration. I told them I would be speaking, and I just asked for 1 or 2 sentences about how their paths since graduation had been winding or uncertain and how it has turned out so far. So over the following 2 days, I got several replies, but not just 1 or 2 sentences. multiple paragraphs describing their journeys and uncertainty all along the way. This theme hit a chord and they had a lot to say. So I plan to take their full messages and make it required reading for all my advisees, all our research lab members, but I am grateful to share just a few of their experiences and things that they wanted me to pass along. And since I'm an academic researcher, I have changed some of the names for their privacy. So one 2019 graduate, Lauren, reminded me that she had spent most of her life training to become a professional dancer, but at the end of her Duke career, changed gears and decided to do her PhD in clinical psychology. Anna, who graduated in 2021, was a global health and psychology co-major who was on my research team and was confidently pursuing a career as a research and policy analyst. But she switched gears and is now completing her prereqs for medical school. One of my graduate students described getting all the way through her final student teaching requirements to become an elementary school teacher before she realized it wasn't a good fit. So she headed to Kenya to intern at a girls' school while deciding on her next steps. Going all the way back to class of 2010, when I was a postdoc, one of my first students applied for a Fulbright to Senegal, but she didn't get it, and ultimately joined a program in Burkina Faso. It was not her first choice, but she's now lived there for 12 years, building a multifaceted career in nursing, teaching, working for community organizations, and spent most of the COVID-19 pandemic caring for patients in their ICU. One last example is Sarah, a class of 2017, who was a cultural anthropology and global health co-major, who has spent her 6 years since graduation working at USAID. That's the U.S. Agency for International Development. And then she moved into a senior leadership position in a nonprofit medical device company in sub-Saharan Africa. Now, these experiences, these career paths followed exactly from the internships that she had sought out here at Duke. It really was one of the most straight paths that I had seen since I'd been here, the type you might be wishing for as you sit here. But a few months ago, I received a request for letters of recommendation because she's decided to go back to school to become a nurse practitioner with a specialization in midwifery. As I've walked along these students on their post-graduation journey, hearing about their new jobs and opportunities, I hear a mix of anxiety and hope in their voices as they describe their new directions. But the conversations sound much, much different than the ones that we used to have in office hours. I hear their language change from the desire to be really sure about the next step to being excited, nervous, and hopeful about just trying the next thing. What might not be clear from these examples is that these students were not wandering from opportunity to opportunity with no direction. Without prompting, they described the threads that connected their choices, their values, and their deepest held interests. These served as their guides. While the steps looked like big shifts, and they often did require big changes, their choices aligned with their values. Anna, who went from policy analyst to pre-med classes, had a core interest in improving the quality of adolescent healthcare, but decided to switch to a direct service route to accomplish that same goal. Lauren, the professional dancer turned psychologist, wrote, "Although these careers may appear unrelated at the surface, my path has always been anchored in a curiosity about human emotion and connection." Sarah, who worked her way up in USAID to scale women's health interventions, knew that she wanted to serve women and girls. She will continue to do just that, but as a nurse practitioner. She said, "I've learned that you need to collect the dots before you can connect the dots," which I thought was great. It is a core set of values and the thread of your interest that will keep your journey all tied together. I want to be careful, though, not to paint these journeys as easy. Even if you do embrace this idea of a winding path of collecting your dots, almost all paths are challenging and absolutely none of them are perfect. My students would certainly echo that. We all make choices that we wish we hadn't. And while these are invaluable in showing us what we don't want to do, they can certainly make life hard for a season. And many times our choices are constrained by finances, family situations, our own abilities and qualifications or by any of the real life circumstances that just come with adulting. Sometimes we have to accept the imperfect and get creative to find the possible paths that still align with our values, even if they aren't ideal. One of my former students wrote that she had second thoughts all the way through her PhD program in clinical psychology, which is a very long time. But she has just landed her dream job at the CDC, and she's using her skills in ways that she didn't know were possible. Another spent time working in a medical software company that really wasn't a great fit for her interests, but it helped her reach her long-term goal of affording graduate school. Our journeys can be hard and require endurance and patience. So this brings me to my last point today. Navigating all these winding paths and imperfect choices is much easier and a lot more fun if we do that in community. When we find people who will support our journey and who we can support in return. So these are certainly relationships with your friends, many of those beside you right now, and also with your families, many of who are also here today. So to the parents in the room, I know that you are invested in where your graduate goes, and maybe you share a little bit of their uncertainty. But as a family therapy researcher, I do have a small homework assignment for you. And that is sometime this weekend, start a conversation about your own winding, imperfect path. Your children somehow might be under the impression that your path was perfectly straight, with wise decisions from beginning until now. But maybe you can let them in on the truth that it hasn't been quite as linear as it might seem from the outside. Hearing your story might just help them to be a little more comfortable with uncertainty and a little less likely to feel stuck. My own father recently wrote a book about his life, and it is full of winding paths, from a paper route in upstate New York to serving in the Marine Corps in Vietnam, to moving to South Carolina to teach school, and ultimately to being a professor who also loves to have these conversations with his students and with me about navigating our winding paths. The book was guided by a series of prompts, and one of them was, if you could have any talent, what would it be? His response was that he didn't want one incredible talent, that if he'd been the most of anything, the best at any one thing, then too many other things in his 75 years of life would have been altered. So maybe it is less about being the best or finding the one thing that you're really sure about, and more about following your curiosity. Collect your dots and trust that they will connect. In closing, I want to say how excited I am for all of you. I'm excited for those of you who will go straight into something that you love, but I'm also excited for those of you who are not sure what's next, and even for those of you who might not love what you choose first. The more your path winds, the more adventures you will experience, and all those twists and turns, including the most fulfilling ones and the not so fun ones, all become part of your story. So I wish you years of perhaps never feeling absolutely sure, but of making brave choices that create an interesting, winding, and fulfilling path. And in this moment, please know that we are all so proud of you for the paths that you've already walked. We are thrilled to be here to celebrate what you've accomplished. So congratulations to you, class of 2023. And now I'll invite Haley up to speak on behalf of the students.
Duke Global Health Institute faculty and staff, admired mentors, friends and family, and fellow graduates of the class of 2023, thank you for the opportunity to speak on this great occasion. I remember visiting Duke for the first time like it was yesterday. It was a sunny, humid July day in 2017, 96 degrees and getting warmer by the minute, and I remember walking into the visitor center to grab different departmental flyers before my tour. biology, neuroscience, evolutionary anthropology, and global health. I remember reading about the different classes in the global health major and thinking they seemed interesting, but I'm pretty sure I folded up my pamphlet, put it in my bag, and never looked at it again. The Haley back then would be shocked to find herself on the stage today. I applied to Duke as a pre-med and as a chemistry major, and if you know me today, you know how quickly I changed my mind on these. I convinced myself I wasn't going to get in, despite fitting the criteria of the student profile. I would not have been able to imagine the academic journey I've been on and the incredible impact of the Duke Global Health Institute on me and my aspirations. It wasn't until I was in the Global Health Focus in PGRIM during my first semester when I realized I could see myself pursuing this field. Between living with my peers and taking classes on global health communications and medical instrumentation in the developing world, I got the overwhelming sense that this is what I was meant to study. By the end of freshman fall, I had moved on from my physician ambition and was all in on global health. The devastation of COVID-19 only solidified my choice, reminding me and the world around us of the need for new knowledge and strong infrastructure in global and public health. But it wasn't always easy. Here at Duke, global health is a co-major. This means, in order to pursue our passion in this field, we had more work to do. We had to balance the requirements of this major with the requirements of the other major, with meeting all the other graduation requisites. Despite the academic gymnastics that sometimes accompany global health, I am nothing but grateful for what this has meant for my education. My peers and I were able to bring our new knowledge of other disciplines and recontextualize them with our desire to help others live healthier lives. For me, my biology classes, alongside my global health curriculum, have inspired me and prepared me for my next step, pursuing a graduate degree in epidemiology. While we may not have learned to use a soldering iron, take a triple integral, or analyze financial markets, we nurtured what cannot be taught. We embraced and applied our empathy, compassion, patience, and understanding for things lacking in today's world to learn strategies to improve the well-being of others. We use these attributes to comprehend and analyze the causes of inequity in health outcomes and the complex factors causing disease around the world. We brainstormed, researched, and wrote about serious public and global health issues plaguing our society today: food deserts, abortion access, mental health care, and more, and practice synthesizing potential solutions to begin to address such complex issues. We even had the opportunity to apply and practice this knowledge with the experiential learning activity and with Dr. Clements in the Global Health Capstone. I am standing here today, as the student I am today, because of the Global Health Institute. It was the accomplished faculty who pushed me to think critically and helped me find fulfillment and fellowship in the field. It was my classmates and my instructors who showed me that my sensitivity, selflessness, curiosity, intensity, and analytical brain were strengths to unapologetically embrace. These are the attributes that will make me and my classmates good tenants of global health. It was those who went before me who allowed me to see my passion for global health, and it was the people in this room who gave me the confidence to know I could achieve my goals. For me and the graduates before me, the Duke Global Health Institute is a safe haven for personal and professional growth. Due to the nature and demands of global health, you cannot pursue this field without kindness and selflessness. You must be creative and a problem solver with a servant's heart. This creates a warm and welcoming community that I have been privileged to have been a part of during my time at Duke. I am so excited to take the next step with my classmates and join the wider global health community. Today, what feels like the end of a story is really only the beginning. We now have the tools, frameworks, and exposures necessary to begin to make the changes we are craving to see across the spectrum of global health, including in reproductive health, mental health, infectious disease control, and social and racial justice. And if this day shows us anything, we have a whole room of people who support us and believe in our ability to achieve these goals. We have mentors to reach out to long after we leave Duke, peers to collaborate with, and the love of family and friends to keep us afloat. So yes, I could not imagine myself standing here today, graduating with a degree in global health. but it has proven to be one of the best decisions I made during my time at Duke. Sometimes the best things and the best people aren't the ones you set out to look for, but are instead the ones you find along the way in a moment of serendipity. Today, I can now see the future for myself and my peers, and today we go out into the world and begin to live out what we were taught here. Congratulations and good luck, class of 2023. The real work starts today. Thank you.
Thank you, Haley, for those inspiring words and being such a valued member of the class of 2023. My congratulations to you and the entire graduating class for your remarkable achievements. I'm Mary Story, a professor at DGHI and also Associate Director for Academic Programs, and I now have the honor of presenting our Student and Faculty Awards. As you've already heard, our graduates are truly exceptional, so you can imagine how difficult it is to select among them for our awards. Even among this very talented and accomplished community, today's awardees have distinguished themselves with extraordinary talent, commitment, and passion for their work, and I'm delighted to share some of their accomplishments with you. Our first award is the Michael Merson Undergraduate Student Leadership Award, which is presented in honor of DGHI's founding director, Dr. Michael Merson. This award recognizes a graduating student who has excelled in and out of the classroom and has demonstrated a strong commitment to global health and health equity through extracurricular activities and leadership. This year's awardee has made the most of her time at Duke, involving herself in global health projects across 3 continents. As a sophomore, she became involved in Basque Connections, working with health officials in Pamlico County in eastern North Carolina to assess needs and barriers for care for the county's most rural residents. This experience set the stage for 2 global projects, one researching the experiences of adolescents and young adults living with type 2 diabetes in India, and one working with a team to implement a peer-based family support intervention in Kenya. In all of these projects, mentors say this student always goes above and beyond expectations. She excels not only in the meticulous work of research, but also puts in the time to develop strong relationships with people in the communities where she works. Her advisors note her ability to create trust with research partners through her cultural sensitivity and sophistication. They also praise her deep concern for others, noting as one example that she gave up a teaching assistantship to a student who did not have other options. As one mentor summarized, she has repeatedly demonstrated deep commitment, excellence, and creativity in her team and individual projects, no matter how small or how large. Outside of her global health research, this student has somehow found the time to be active in student organizations such as UNICEF, Tech for Equity, and Engineering World Health. She has been a research assistant with the Duke Margolis Center for Health Policy and a peer coach for adolescents and young adults with chronic health conditions. She's graduating today with majors in biomedical engineering and global health, but we're not saying goodbye to her yet. She's enrolled in our accelerated master's project, Masters of Science in Global Health, and already is working towards her master's degree. So please join me in congratulating the winner of the 2023 Michael Merson Undergraduate Student Leadership Award, Nikita Gopasetti. Next, we will recognize the outstanding research project from this year's capstone courses. All of our global health majors take a capstone course during their senior year. They work in small teams with outside organizations and experts to design a practical solution to a global health challenge. These projects help students learn how to work in teams and how to manage the many factors that come into play in implementing health interventions. This year's outstanding capstone project is HeartWorks in Pamlico County, North Carolina, Progress, Practices, and Performances. For this project, students work together alongside a local partner organization, HeartWorks, in Pamlico County to assess the program's impact on physical health and mental health outcomes for underserved youth in the county. The judges noted that the paper was well-written, well-organized, highly professional, and provided actionable, practical, sustainable deliverables for the organization. This project was completed by students Audrey Alexander, Afreen Ashraf, Harrison Chen, and Nadia Bay. They were advised by Professor Dennis Clements. Students and Professor Clements, could you please? Our final award today is the Global Health Undergraduate Professor of the Year, which recognizes a professor who's been nominated by the students for demonstrating outstanding teaching and mentorship. This year's outstanding professor wins praise for making complex topics accessible and relatable. In her Social Determinants of Health course, she makes frequent use of case studies and current events to show how global health concepts apply to real-world challenges. As one student wrote, she always ensures that classroom learning is connected to real-world issues in the realm of global health, which makes learning more impactful and engaging. Another student noted how this professor encourages students to collaborate and discuss topics in small groups, creating room for students to form and voice their own opinions. As just one example of her innovativeness in the classroom, this professor spent hours designing a board game to demonstrate the many factors that can influence health and well-being, and then devoted class time to let her students play and discuss their experiences with the game. And I was one of the people that helped beta test the board game, and it was really pretty amazing. It's just one way she really creates memorable lessons that will stay with students. So it's my great pleasure to present the 2023 Global Health Undergraduate Professor of the Year Award to Dr. Rukmini Balu. Dr. Balu. Congratulations to all of our award winners, and thank you for your inspiring work. Now it's time to honor and celebrate our graduates, so I'll ask Laura Bai to come to the stage to begin the ceremony.
Good afternoon. I'm Laura Bai, DGHI's Assistant Director for Curricular and Student Affairs, and it's my distinct pleasure to present our 2023 graduates, the 10th class of Global Health majors. Each of our students will walk across the stage as I read their name. I just want to remind you that we do have people watching the ceremony online, so please keep the middle aisle clear. And we do have a photographer clearly taking pictures of this moment, and those photos will be made available to all of you in a couple days. So let's begin. Elisa Adakari. Audrey Alexander. Afreen Ashraf. Serenity Bennett. Nadia Bay. Harrison Chen. Hanul Bentley Choi. Alice Chun. Haley Cienfolo. Isabella Cosenzo. Jasmine Daniel. Sophie Finkelstein. Barrett Gabru. Emily Gitlin. Nikita Gopasetti. Michelle Huang. Elizabeth Kaisman. Mari Kozma. Jenny Lee. Priyanka Misa. Mia Murphy. Molly Plenicky. Joshua Serafian. Yajar Sriraman. Cameron Stafford. Hannah Zellinger. This completes our 2023 graduating class. And as our students are making their way back to their seats, I'd like to note a few things. First, if you came through the front entrance today, you probably noticed the banners we put in front of the building. These banners reflect DGHI's core values: humility, compassion, respect, cultural sensitivity, collaboration, diversity, and inclusion, and a commitment to impact. Graduates, thank you for how you've upheld these values during your time here, and I encourage you to continue to embrace these values going forward. Second, I'd ask everyone to remain seated as our graduates leave the hall. Once they have left the hall and processed, please join us in the atrium for the reception. And so for one final time, graduates, congratulations from all of us at the Duke Global Health Institute. Graduates, my last instruction to you, please rise, and Lisa will lead you out of the auditorium. And family and friends, thank you all for celebrating with us today.
Oh, wow. And it's a good thing I got 5 more because there's 3 left.
Yeah.